Hi everyone, my name's Amanda Pike. I am the chair for the Maternity Voice Partnership in Lincolnshire. And in a minute, I'm going to be adding on our good friend Yvonne McGrath, who is the consultant midwife for Lincolnshire. Now, we thought today it might be a really lovely idea for us to come on and just have a bit of a chat about the Covid-19 vaccine for when you're pregnant. Now, the chief midwife for the entire country is a lady called Jackie Dunkley-Bent. And I think it was today or yesterday, she came out and has urged pregnant women to come forward and have your vaccination. So we thought you might like a bit more information about it. So I'm going to add Yvonne in a minute. It will tell you lots about it. The other thing I just wanted to mention is we're going to have a survey coming out in the next, well, probably early next week now, in relation to the COVID-19 vaccine, just to find out, were you offered it, didn't you take it, and just to learn a little bit more around what your thoughts are on it. So yeah, so keep your eyes out for that. So I'm going to add Yvonne in now. Hi Yvonne, great to have you here.
Hi Amanda, how are you today?
I'm good, how are you?
I'm good, thank you. So we thought we would just do this sort of impromptu Facebook Live because we know that COVID and COVID vaccination are really difficult decisions for women to make during pregnancy, and lots of people have opinions about vaccines. And as with everything, it remains your choice what you decide to do. So today, this is very much about giving you as much of the information and evidence that we can. I will be referring to my notes to make sure I give really accurate information, but this is just to give you more information, and the Better Births team are posting some useful links to more in-depth resources than what I can do in a Facebook Live, just to make sure people are making a fully informed decision about whether to get the vaccine or not. So I guess I'm going to start with the kind of the big question is it safe? Is having this vaccination safe for me and my baby? So in other countries, the UK initially didn't recommend giving it to pregnant breastfeeding or women who were aiming to conceive. However, in other countries, they started offering it as an option to women right from when the vaccines came out. So that's a real positive because it means we have real world data about what's happened to women who've had the vaccine. So over 130,000 pregnant women in the US have been given the mRNA vaccine, so that's the Pfizer or the Moderna vaccine, and there haven't been any safety concerns raised, okay? And the JCVI, which is the vaccination kind of responsible for giving all the vaccination advice in the UK, recommend that pregnant women have the Pfizer or Moderna vaccines. Up until May, Scotland, so Public Health Scotland reported that 4,000 women had received the vaccine with no, that was up to May data, with no serious adverse effects recorded. And although the large clinical trials didn't include women, there were women who got pregnant. And although we can't say with complete certainty that the vaccines will work as well in pregnant women, there isn't any reason at present to think that they won't. And since we've had, and pause if you've got any questions, Amanda, anything about anything I'm asking. So the vaccines don't contain anything that we know is harmful to pregnancy or to a developing baby. And studies of vaccines in animals to look at the effects in pregnancy have shown no evidence that it can cause any harm. So the vaccines that we're using in the UK aren't live, so you're not going to develop, or it's not going to cause you to get coronavirus. And non-live vaccines, which is like the flu and the whooping cough, which lots of women are happy to have been shown to be safe in pregnancy. Okay, so that's kind of some of the safety data. Did you have any other questions or anything I haven't covered in that you think people might be thinking?
I don't think so. And you have popped the links to some of the research in the chat box, thanks to the Better Birth team, that you supplied with us earlier with. So I'm sure people can just go and have a little look at those, which will help them. Yeah.
So then I guess the next question is why? Why should I have it? And there is many benefits to having it. So first of all, there are some women who will have additional risk factors. And those additional risk factors are things like if you have an immune problem, diabetes, high blood pressure, heart disease, asthma. if you're overweight, if you're over 35, if you're from a Black or Asian minority ethnic background, or if you're in the 3rd trimester of your pregnancy. So that in and of itself, even if you haven't got other risk factors, is a risk factor for becoming more unwell with COVID-19 than if you were non-pregnant or in earlier pregnancy. And we know that the majority of people who get COVID won't become very unwell. But we have, without being alarmist, since we've had the Delta variant, we have seen across the country more women being admitted and more early deliveries related to women being very unwell with COVID-19. Therefore, the conclusion from the research and the evidence available and what we've seen happen in real life is that the risks of the vaccine outweigh the risks of getting COVID in the 3rd trimester. So what that means is it's safer to have the vaccine than it is to have COVID in your 3rd trimester. So lots of women, as I said, will not necessarily become very unwell, but of the women who are unwell enough to be admitted to hospital, and I'm just going to check my statistic because I believe it's 10% are admitted to ITU. Let me just double check that. Apologies. I just want to make sure I'm giving accurate information. Of course, I can't find it in my notes for now that I'm trying to find it, but I believe it is 10%. Second. No, it doesn't want to be found.
We can pop it in the chat box in a bit.
Pop it in the chat, yeah. But we know that there is an increased chance of becoming unwell in the 3rd trimester, which can then lead to an early birth of your baby if you become very unwell. Mm-hmm. So that's why there's the RCOG and Jackie Dunkley-Bent, who's the Chief Midwife for England, have come out in support of women having the vaccine. Now, I appreciate, even with everything I've said, that is still a difficult decision for lots of women. There's lots of resources that we've popped into the chat box. So you've got all of the RCOG information, the information from the government, information from the NHS, and the RCOG link does also contain a decision tool that can help you go through and help you figure it out. And you can, of course, have a conversation with your midwife or GP as well around that decision making. But on the balance of available evidence that we have currently supporting coronavirus vaccination for pregnant women, the evidence does support that, particularly when we look at the risks associated with contracting coronavirus in the 3rd trimester.
Yeah. So, yeah. That's brilliant. Will women, when they see their midwife or go to an antenatal clinic, be given any more information? Is there something that they can take home to look at their own time?
Well, they are giving out leaflets in antenatal clinic. We're not currently in a position to be able to offer it in antenatal clinic. That may change over time, but that isn't currently where we're at. So it is booking yourself in through the vaccination hubs. But yes, absolutely, there is more information available.
Great, thank you. And we've talked about being pregnant, but I know previously we've done a previous live, so there's probably some more information in there, although it might not be as updated as we've got the links to today. But yeah. I'm right in thinking it's also safe for breastfeeding mothers.
Yeah, absolutely safe for breastfeeding, and may offer babies some protection. Although babies and young children don't tend to become unwell with COVID-19, the antibodies have been found in breast milk, which doesn't with absolute certainty means it gives protection, but it may give some protection to the baby as well.
That's brilliant. Okay. What does somebody need to do if they think that they might have COVID-19?
So if you think that you have COVID-19, it's first of all, it's keeping an eye on your symptoms. So it's staying at home, social distancing, not going out, getting yourself a PCR swab to confirm whether you have it or not. And then it's all the usual self-care measures if you're unwell, but assessing yourself for if you're deteriorating. So if you've got concerns that you're having difficulties breathing, that would be reasons why we'd want you to contact us. I also really want to emphasize that if you've got any concerns about your baby's movements while you're unwell with COVID-19, do not delay in calling us. you know, it's really important that you still contact us if you've got a concern, and you will still be seen. So you're not going to not be seen because you've got COVID-19. So all of the other reasons that we tell you in pregnancy to contact us, such as reduced fetal movements, bleeding, severe headaches, severe itching, constant abdominal pain, labor, if you're in late pregnancy, or even earlier and you think you've got signs of labor, all of those reasons would still be reasons to contact us and reasons to be seen and reviewed by your midwife and doctors at the hospital. So, you know, please contact us if you've got any concerns at all, and not to just think, well, I've got this, I'm going to wait. We still want to hear from you, and that's really important. Especially as we know it can impact on the third trimester, so we want to hear from you.
Yeah. And if somebody's got just a routine appointment or a scan and they suspect they've got it, they've got to ring you, don't they?
They've got to ring us. We can assess your wellbeing over the phone, but we will delay appointments where possible. So we will see for essentials and emergencies, but if those things like scans and routine appointments, they can be rearranged.
Yeah, brilliant. Okay, so if anybody's got any further questions, we're not taking them in the live chat today because we've got some time constraints. However, feel free to ask your midwife, and I'm sure they will be more than happy to speak to you. Am I right?
Absolutely.
I'm mastering for you, but I just know what you're going to say because we do so many of these events. And I think that's everything. If anybody does have any questions, do feel free to send them into the Maternity Voice Partnership and I can find out some answers for you and forward them on. Okay, thanks for joining us today, and we will see you next week on Friday at 1 p.m. Okay, bye for now.
Take care. Bye-bye.